On our Kusha on our Kabo, on our welcome to the first program back after we 5-year anniversary to the Well Body Better Pass Gentry program when as Salomon Dodo land Boku book now then they present to Una. Me, your name Natimo John Fuller, me not to a medical person, me a business IT consultant, I specialize in cybersecurity. But I just there no for help them book my let they bring this program to Una uninterrupted. Okay. Today now Dr. Mohamed S.I Kamara 90 present today. And today now we 83rd session. For all now we know we don't go on for 5 years and recently we celebrate to 5 years anniversary. So shout out to all the one that we in various ways on our support we over the years, even up to the day, we can celebrate with we on a plenty. Thank you. Today we deal with M-pox, and as you know, that's something we don't come 2022, but it don't surface again, that's alone, especially. So today the presentation, yes, we look at M-pox generally, but a more focused around with people as alone. Okay. This program will go and count on a free of charge. We ask still CDI if anybody get any way for this program with you people in a tongue, either via radio or TV. We will be happy for have that conversation with the person. However, we not get money for pay. We not get money in our coffers. You know, we give up a lot for bringing this program to people, but we free, but we happy for getting this program free to any channel. We want air we not go charge them. Let them just tell what they want, how they want, and we'll try for make sure so we get it done. Today that's Sunday, the 29th of June, 2025. And Dr. Kamara the present, but the whole Well Body Better Pass Gentry team go there at hand for give their support. Okay. So if you get any questions, we will try for answer. However, please, me fan them, please. Some question they need to say we not go get the answer or not to say no sabi the answer, but because we not get you medical background, we're not able to give personalized advice, like general advice we're able to give. If there's anything personal, we go say let you consult your physician. If that's something where a member of the team willing for give advice on, they will definitely ask you, let you get some tests done for them to get an overview of waiting any underlying conditions of waiting you know the disease where you get, so they able to give you proper advice. Okay, we'll continue. As they say, we already present people and we will just decide on for come together and being the program here to people and for come sensitize people about different type of diseases and illnesses they're within the world where we can suffer from. Waiting cause them thing in the why how they get them, why would they get them, and if you get them, how for manage them, when for go hospital, when you go hospital waiting for ask but then kind of thing and I make we get this program. But the first and foremost thing we can always try for tell people how for prevent, for letting tear not happen. Like now, no, prevention is better than cure. Okay, like they say before, the program will be on YouTube and Facebook. We also get to WhatsApp group. I will share the link to the WhatsApp group. You don't need to ask me, for let you join. You can join at any time you want to join. I will send the link to join. But at any time we want left back, you don't need to ask me for let you come out. We ready for come out, just delete yourself. With the hopes that nobody will come out because we try for reduce the amount of noise in the group. Normally, we not put anything no more just randomly. No. The only people that we get access for post anything are with the admins them, i.e. the people that within the Well Body Better Pass Gentry team, and within they put in something for do with health related issues, and not to very often they post. So for them, they will not let Boku posting. This will be perfect for them. Okay. Now for way time we reach for ask question, or I can either use and the way sabi, digital stuff like a you can use the app. If you go now, there's a 3 dots there. If you press that dots there, this will come up. You press on the chat for send a message, or you can press this for raise your hand and ask questions. Okay, then for we were bold enough. For some of we were not bold enough, maybe, or maybe you saw the background not good. Feel free for send we a message. Text your message, and we will try for make sure we answer. Now for that, we will not have to do this. You can still raise your hand up physically as long as if video turn on. I go acknowledge you as I see you. Now, please, if I not get back to you quick, means I ignore. It just means I not see you. But once I see you, I will make sure I come to you and let you go ask a question. Okay. Well, I thank you very, very much. Plenty, thank you. I'll pass now to the bookman. Me, Boku Talk, Done. Dr. Kamara, over to you. Thank you very much.
Ronaldo, thank you. Who will not join me today? We hope say we will benefit we all. Una, do you hear me? So
Yes.
now all go benefit from this, and we say go benefit from it. So thank you very much. This talk here today, reason make we decide say that this topic I will for start with, because as we talk so that this sick in the more with people than we country. Me in particular decided to make a talk on this thing today because waiting to I see this thing Facebook, social media, we really touch me. Somebody give a tribute to a lady. For GDPR purposes, I no go call her name. And as I say, a young lady, we catch this sick, what they talk about today, M-pox, as I see them. They call her monkeypox, but of course, they live in a politically correct world. And so therefore, people they get stigmatized when I go find out later on as they talk, they go on. Old man, they point finger, they talk and this and that. And so they decide for changing them from monkeypox to M-pox. But this woman, within them talk, they say a beautiful soul, sweet, vibrant, full of all big dreams where you get, And then this lady, unfortunately, can't catch the sick. Now, in family, they look up to them with pride and hope. So, then can go admit him na the military hospital na Freetown. He did it for about 1 month or more. At that time, then they look at him and say, this thing not to win name, not a big thing. He go pull through and everything fine. All the prescription they make for him, where they write for him, he take all, then buy all, spend money. But to say, they don't see no better. If anything, this man just deteriorate to the point now where the rash where you get now body begin pull this water, and begin discharge all this thing they come on in body. So then of course then take her now from the transfer them to the Connaught Hospital, the teaching hospital. Now they now where they notice say this man they improve at all. All the test them, then spend well over 20 million. In the end, this poor lady lost in life. And I say self-talk, I'm say when the tendon reach, I say I don't think I'm going to make it. I don't think say I go make it. And then people here they make things easy for me. In fact, the person who write the tribute is say in the day we want the staff member them alapana, where in actual fact the person where the clinician is supposed to show compassion. Now, this person by the time, this woman way by the time we this sick don't ravage enable team up, enable worker. Anytime we decide for team up, and that they're in a lot of pain. So obviously, then do all waiting and get for do, and in the end, as I said, then spend over 20 million, and sadly, this poor woman lost in life. So that inspired me say, well, hang on, waiting make this thing they happen, and why it is we deal with how we do so, because this sick we don't come, as remember. 2022 and 96 come where we all been worried about them, and now for some reason he don't come back in salon, and to the point now a lot of people in the die. So for let we not go far, let we talk within that this thing. I can always like for begin with a definition for try for define within that this sick, this Mpox. Well, Mpox na sick way na virus because of. Not to any kind of virus. Now, virus we belong to this particular group we then call orthopox virus. And that orthopox virus, you get different virus. Then you get cowpox, you get this smallpox, you get the Mpox we don't see now, different one. Them. Now, it's difficult for anybody to say if I look on the blood, I go actually diagnose this, because if you do harm them probably until you go get the one for the virus we and the mama, this orthopox virus, because they're all similar. But when you get the specific one for the Mpox, you go see them and that will make you clinch the diagnosis. Besides that, some other thing then they when are features them, when are symptoms and signs them, where you go take for say, oh, this one specifically for that, but we'll get for no about that. So then divide them to two type them. You get clade 1, clade 2, and then two then they clade 1 and 2 based on the gene them. Because remember, if you will be deal with COVID, for let they actually say they don't find COVID, now the gene in them find of that virus, and then get the name. So now the same thing like this. So then get 2, clade 1 and clade 2, and clade 1 instead divided to A and B, and 2 instead divided to A and B. We will see that. But they're now based on the way this sick they transfer from one to the other. And then of course the amount of the virus will hit you at one particular time. How we go upon you and waiting to be you state of your health before this thing hit you. Sometimes on Monday you go hit and bad. Some man they go eat and less, or some man they go there in between. And some man they go get them, you know, say even get them. Then, of course, depending on the area and the world where you there. So these are all signs and symptoms. This is not in the way they actually determine how the person will progress. So a bit of background and history. 1958, not to say that today this don't begin. Now monkey them with them in there in a lab na Denmark, 1958, them find this virus, this M-pox. But they not even immediately find them per mortal man until after 12 years. So 12 years later in 1970, them find them. And the one way they find them from the people that we've been come out Congo, Democratic Republic of Congo. And then thereafter, the next year, about 12 months later, then catch 6 cases that we then get, where again, Congo, have been the main one, but not been just limited area, now one area, them, the suburb them, the identity have been there, and then of course, even just sporadic, even just they come and go, it begin, it end, and then of course, then find out, say, this thing now, not only they go from animal to animal, but they go now from animal to human. So by 2003, then the first time they see this thing outside of Africa. We're in America, as you know, America is a hot hub for tourists and things, especially in the summer, like how this one now. There are 47 cases they may get, where again, animal to human being, the transmission, how one they pass from the other. Well, in particular, they say the people this thing been common, and people who get this particular kind of dog, where they call them prairie. Now the way some people dog business, they go waiting at this breed way. I think they mean get that. So when they play with them now, and all that, until then crash them, then obviously then catch the sick, and that's how they get them out of Africa. We're now 47, but the one that we've been there, Africa, now Ghana, then catch them, and people that we've been get contact with arata them. So then bushmeat and things. That now know that's how this thing doing. Then about 14 years later, almost 15 years, then catch Nigeria, we passed 118 cases them. That have been the largest at that particular time. Again, now outside the countryside, now most of them then catch them. Then, of course, fast forward to 3 years later, 4 countries then get them. Again, outside of Africa. Then, of course, 2022, when the main one they talk about, now the tender, it become an emergency, public health emergency of international concern. And then they put that in the fake, So this is the 23rd of July. By that time, they get almost 100,000 cases. Out of the 100,000, you get 207 people and we die. And in particular, not one country or one continent. This is now 122 countries in the world. But you see, most of the cases, cases that we've been they happen outside this particular virus, they all the time, endemic. So non-endemic means, they do all the time, they come and go. And why that happened, well, is another thing we will also think of for discuss. And of course, if you watch the bottom line of that particular, they put on, they say, rapidly spread via sexual contact. Because what you do at that point in time, mainly na man where they within company man, in them dependency care from. So now that part of the reason why they decided them to change them from monkeypox to M-pox, because we didn't they stigmatize people. As I say, we will talk about that. So by 2023, now they officially say, well, this one don't dawn, that particular outbreak or that particular issue they don't dawn by 2023. But then, of course, we know say 2024 now. Well, again, it don't begin come back, and in particular, Salo and I will talk about today why. But we need to find out. But if you watch clade 1B. Now in them find say the new sexually transmissible strain. So now through do mama papa business sexual intercourse, now you can get that in there. So I don't talk a bit, but I've been just one for Leona listen to waiting the BBC being recorded and sent to Leona get a bit understanding. So I go try and play. Play.
Next, the highly infectious disease M-pox has been declared a public health emergency of international concern.
Yes,
oh, that's good.
The disease, formerly known as monkeypox, has spread rapidly across Central and East Africa since the start of the year. The initial outbreak was in the Democratic Republic of Congo, which has now registered 15,600 cases since the start of the year and more than 500 deaths. Health officials say the new strain of M-pox may be the most deadly yet. Joe Inwood reports. It starts with flu-like symptoms and ends with this. This is what M-pox, which used to be called monkeypox, can do. Here in the Democratic Republic of Congo, the virus is common, but it's spreading. It's transmitted by physical contact or through the air. 5-year-old Sandrine has now recovered, but it was a terrifying moment for her mum.
She had a high fever and then she started to get lesions on her body. She had rashes on her arms, on her abdomen and even on her tongue. I'd been told it was a serious illness that could kill her, so I took her to the hospital.
Although it can be sexually transmitted, in the crowded camps of the eastern DRC, most of the patients are children.
So far, we have 130 suspected cases, and half of them under 5. Just 5% are adults. The most common way to get infected is direct contact from a sick person, and in the camps, children, they play together.
The latest outbreak has killed 450 people in the DRC. It seems a new variant, called Clade 1b, is more virulent and more dangerous. And it's now been detected in neighbouring countries, including Burundi, Kenya, Rwanda, Uganda, and the Central African Republic. And so, the World Health Organization has declared a global health emergency.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
It is possible to vaccinate against Mpox, as happened in previous outbreaks. But these vaccines are not widely available in the DRC, where these children had to rely on their immune systems. The WHO is warning if more is not done to stop the spread of this new variant, the consequences will spread far beyond these camps. Joe Inwood, BBC News.
So, thank you Naim, for watching and listening. But as one can see, it's more dangerous and it's spread faster as well. So, the highlight is such that they don't add one more member state when our own country is alone. And at the 10th of January, then declare them. So the second case, then confirm on the 10th. But if you watch Naya, you go see, say, the 9th of January, same year, and the Chinese authority then they announced they own Clade 1b. The index case way, look at more. Surprise, surprise, they say it travel go Africa. And if you watch that, 9th of January and the 10th of January, so I can't say that's alone, probably they all that 13 country and 90% don't go. Again, we don't know, but it's just very interesting, say, from the 9th to the 10th, a few hours, maybe 24 hours, yet you got find out, say, Chinese man, and say 1B when we know that the strain, now the outbreak, it's passing come out Africa. Then you get then 13 country here. Out of them 13 year, you get 8 country them where the sick they under control, i.e. 4 of them, and the 8, when a half of that number, they don't go without any case reported in 3 months. We in other countries, South Africa, Gabon, Morocco, and Zimbabwe. Well, as we know, Salone not there amongst them, but we will get to see the statistics of Salone. So, as we say, we don't talk about this Clade 1 and Clade 2, now the division that of this particular dangerous virus. Clade 1, as you see, they mainly this Congo basin in Central Africa, and then of course the way they affect people, they affect the Tranga one. But that now up to 10% of people way if they contract they catch the sick, now then go die. Most of the time, for let the sick pass from one to the other, now through mortal man to mortal man. With the Clade B now, the transmission from mortal man to mortal man in lower, and then the number of people who can die or the percentage will go die now 1%. So you can see a difference between waiting they happen for Clade 1 and Clade 2, and you can actually tell the difference. But if you say you look at just the blood test, you might not be able to tell which one. And I make it fine for we get them kind of distinguishing features now. Yeah. If you watch, you go see say Salone na Clade 2B, and don't with people are now away from January, then still they suffer with that. And then of course they say Clade 1B, then detect, as you see in China. But of course, they link on to the person who travel to Africa, just like I've been saying at the other slide. So, 1A, 1B, again, this one just to tell you the key differences, from the year outside the first case come out to 2023, how this thing happened. You see the number of people that will go die. So if you get out of 100, you get up to 10% when the first one, and then 2023, you win a clade 2, you get more about, maybe less than that, definitely. Then the transmission, how this thing they come out from one person to the other. Again, we see animal, person to person, and then formites, then other things they waking bed people. Then, of course, primarily from 2023, we say man to man, mainly, and then they don't call them, then they transfer the sick. And mainly, of course, now you get the tourist area, tourist place that way, then really, really very, very common. So, again, this they tell you no more. Clade 1 day, and clade 2 days. So clade 1, obviously, is more powerful. It can do a lot of harm, whereas clade 2 now not as bad, but in the spread faster. And that for telling you as you can see, the virus they all the time na DRC, Congo, and then of course in 2023, well, they're under investigation. But then in 1970s, then get South Africa, Europe, in a clade 2B. But the endemic zone then now for a particular one, as it is, then say West Africa, including Salone. That one that win in 1970, but 2023 now, there's an endemic. So there's something there we don't happen. We don't bring this virus back. We make it affect to people and do. So, and the Sierra Leone data, if you watch, you go see say up to the 27th of June, when the latest one we will get. I think then get a website, Facebook page where they give you a daily update as to what's in the happen. You will find out if you watch out, you will see say almost 4,500 people them and then don't HD sick in total. Out of them, you get the one that we don't recover after 2 to 4 weeks, about 3,500 from that, or just slightly above that. Then you get the active case them. The case with the people and still they suffer 724, and then of course, and the way they just say, okay, they don't reach the 4-week mark now, then they look better, the rash done they well, and then they're not infectious again, they're not contagious again, about 13. But again, in view of that, you get more cases, 22. And that makes Salone not in that group where they say about 3 months, they not declare anybody new. Well, if you break them down into district, then you can say side people them they way since the war came na free tongue alone, the people they not go back na them village them. You will see say because of that clustering, because of that way them that you will find out 2,500 inside the urban, and then about almost 1,000 na the rural na free tongue. In effect, I would say over half of the number of people that we don't catch this sick now inside free tongue then they. So it tell you something about being in that particular area. However, we go for discussion and see that the way an expert then will probably tell you whether indeed there's something there waits until you better for lay in another place there or you in a free tongue. Because what you do, if you catch the sick and then you don't know side for go, or if for go at the center or line that, and then you're in a small place where tight, it might just be a risk factor. So if you watch, you go see say, as I say, 10th of January, and then declare we on the second case. But if you watch from that 10th now to February, March, you look at you see not to tell you for see. This is the thing just the rise. You can see there. You see, so at this point in time, as I say, we don't get over 4,000 cases then, but that's it. So when we go see the drop, that I don't know because we know the free tongue, but then the way the free tongue, sometimes they go for FWE, sometimes they see a different picture. But clearly, from the people who've been there high up in January to even April, May, probably in June now, probably then don't they reach the peak and then go begin calm down. If we don't get the vaccine, then we don't get the measures, we don't get the awareness, we don't get the education, clearly we will begin to see a difference and the cases then will begin calm down. So how this sick they come out from one person to the other, as we can see, you can see say mama can give pikin where they in pregnancy, and if you get affected, the mommy sometimes can it can actually miscarry. At the same time, if he carry the pikin right through to a certain age, gestational age, as they say, the possible say it can born the pikin prematurely. We then they say get your own problem, and of course, you likely say the pikin can die in the belly. Now it's a very sad story because it's not only dangerous for the pikin, although you don't die, but for the mommy says it's dangerous. So clearly, now team we need for really take care of. So not to just man them no more, mama themselves, sister them, until then they're all, you know, they're in danger. Apart from that, if you don't get away they born, it's possible to say way they breastfeed, they can get that, you know, and that can lead to, of course, the pikin get infection. Then you get the other side now, when animal to human, the animal, then the way they play, like that way I've been telling you just now, the dog in breed na prairie, way in America, now so because then they play with them, now so they take them. And of course, then monkey where some monkey eats, like I know they call the country them, but some man, this is an exotic diet. Bushmeat, my granny, my grandpa be known to eat, I'm not, you know, that which make me know for do am. That now other thing, you just they tell you no more. Then of course, if we cook the meat of the animal, we get the infection. If you not cook well and the virus not die and the cooking, it's possible so you can catch it. So that's one way. Then of course, you get the one way, the most dangerous one now way, as they talk about that film there, if you they cough, you they sneeze, you they talk to the person, you they sing to the person, it's possible to say you can transmit this thing to the person, as you can see. Because if mortal man, you cough or sneeze, should I say, now like 10 meters outside the thing they go. And because you know they see I'm not droplet, now I make this thing they spread as badly as possible. Plus, of course, like we they work with them, if you're not careful, you know, wear the gloves, you don't get the thing for protect your face, your body and all that. And then this thing they discharge this liquid or fluid secretion and all that. It touch you and you don't know about that because you don't go know immediately. It will take you about 14 days, 10 days, then up to 21 days maximum for let you know. By that time now, as until you don't pass on to people that we don't even know. So again, if not to that, then who that they look after them, the cutlery, you know, then kitchen thing that they use, all of that get forbidden their own rather than go mix it with the general public. And we look now says sexual transmission. That's another thing. So all the things are naturally important for level for know how to try and stop this sick. If the sick begin, we know for stop them. At least we get way now we will go know, we will go for try for bring them back under control rather than make it just carry on like that. So within the factor them Sierra Leone specifically, but I don't talk about this. The high risk behaviors where we get people and say pass them eat bushmeat. So man natiwe na national diet or something or natiwe important for let them do them bushmeat and they definitely from 2023 now they find out say 38% now can cause that. Body to body, skin to skin contact. People can look for go take part for maybe mend the person or maybe if the person die for go wash the body, tie them up and all that without the appropriate precaution. That now another thing making happen. And then of course the people in way they delay treatment because we do stigma. I remember I said I've been mentioned that word there. UNICEF don't actually investigate them and don't find out say 60% of people we need they come for cancer treatment not because of the fact say then the worry say then go talk about them. But we will talk more about that as we go towards. You get the environmental and structural risk there. Again, some money they pay attention to this, but then on the hand, which you call it now, paper within the give say, this one you can build now, then begin chop the trees. That deforestation, they definitely they encroach into the animal, their habitat. You see, they say live and let live. If you allow them for let them do their business, they not in that. But inside the Eastern Province, Nigeria, very common. Then they encroach into the animal habitat, and in so doing, well, nature they fight back. And that's what exactly we get. So now we go for Mplaba and then the team fight back at we. Well, in that we get for deal with the consequences. The surveillance, you know, whether they give Bakan and no one call name or whatever, say, but that's it. Only 15% of the suspected cases then go get the laboratory work confirmed. It's not to me the talk about this now, the big organization, WHO 9 the talker. Then of course from border to border, Salone, Liberia, Guinea, we call them it's not the MRU, that's it, Mano River Union, possible. I remember I say we Ebola begin, that's how this thing begin from Guinea, somebody go and then they come in and that's been the index case and that's how it happened. So this is way come on, way naturally known saying that's how it can happen. So we need for try and get safeguards against this kind of thing. Then of course the population, the extremes of life, the very old and the very young, then definitely they're more at risk. And if you watch, Salone population, about 42% now under 15-year-old. So it just goes to show you. You see, and of course, if you look at this, 33% of the cases them now under 15-year-old and I declared 9 at the problem. So rural communities then get limited access to diagnostics, like I've been talking just now. You're not able for CAM at the center because maybe you don't get the money, then they about 100 kilometers away. All that the impact on seeking help. And then, of course, they don't get this M-specific PPE. We're not the team way for wear the protection, the apron, the mask, and of course the glove them. Wait for epi to wash. And of course, when you don't do that, you pull all the thing, you get for wash your hands immediately, or even before you treat the patient, but then immediately after that, you get for don't do and to top that, one water, soapy warm water, and then of course you then use your hand sanitizer, which will be very important. Now we need for do that because otherwise we'll just continue for day in circles. So when we don't talk about the risk factors and the other things, obviously we need to talk about waiting for look for. So how this thing they begin, it affects almost all the parts of the body. If you watch, it will affect the brain, where the person will begin with headache, and then it can cause confusion, and then the person will collapse, just similar to malaria, that cerebral malaria, where it can cause that in there like that. So encephalitis, now one thing, it can affect the eye and conjunctivitis. It can affect the mouth, and it can cause problems for eat, for drink. So therefore, the person can prone to dehydration. And if the infection worse, then of course, until then they pass, they get for put under the machine for breathe for them. Then of course, one thing we're very important is the lymph node them. The quick area and person get growing. If you get at foot, we'll be they play footballs and then the toenail come out, we don't look after them, then the foot get infected. You feel that swelling that the groin, the right or left. The same thing. If you shave, now you ampute, and then you cut the body, then the bugs go in again. You go feel that in the, if you get tonsillitis and like that. So the lymph nodes then they swell, and the lymph nodes now one way that's in the way they protect the body. So it's important for remember that, you know. And then of course the muscle and the heart, that typical virus. That's what we can do. And then of course we get the bowels, the gut. If you go, you affect the gut, and then you can get that way then called abscess, it bosom, and then of course it can cause peritonitis, where the person can die of shock. Then of course the epiglottitis, a dangerous one, a very important emergency that the way for person for know about. So the symptoms them they vary from mild to moderate to severe. Now obviously if you involve the brain, it's very, very severe, very, very dangerous. There's no questions about that. If you involve the gut and then the gut boss, again, it's dangerous. If you involve the lung, again, you can get pneumonia, and then it can cause problems. But of course, we got to remember the people within this category we don't call immunocompromised. That people in ways sometimes they get cancer, or sometimes they get treatment, sometimes belly woman them, sometimes they don't get transplant. Operation them where obviously now the body defect against the organ within transplant, so clearly the people in the day at risk, and so important for make them guard against any complacency for letting occasion sick, because it can cause problems. So somebody be ask me this question, say, well, hang on, what we go take for no say this na the sick? Well, now the answer this. If you watch Naya, you will see say, as I've been talk, when you catch the sick, not to say they get for know about them immediately, it can take up to 21 days, 3 weeks. Imagine that. At that time, you go about your business, you don't know nothing, but you feel the symptoms, you don't even know, but there you go. So the first thing them, we go begin feel, as you see, this nine distinguish this sick from the other sick them, like smallpox, chickenpox, syphilis and all that. Now the lymph nodes, the way they swell, now the groin, then particular nine, they actually feel that swelling, then at that night distinguish them from the other thing. Of course, you go get the fever, the headache, the pain at the muscle, then, and all that. This lymph node, lymphadenopathy, nine, the distinguisher. Of course, if I touch the eye, as I say, you will see conjunctivitis, you can get ulcer, then at the mouth, the tonsils then can get inflamed, and of course, the rash. Now, we will look at the rash. The rash, USAID, is slightly different from USAID go day for smallpox and USAID go day for chickenpox. We will see that. And then, of course, I say, this thing they continue with this rash for like up to 4 weeks. So after 4 weeks, you go well, but you go left some scarring. So there you go. Now you think that not only one, you say all the boku way fever, and this rash. This is not the problem. So if you look at them, you get chickenpox, smallpox, like I've been saying, and that way they can say na malaria, we can catch you in the mouth. They right now the upper lip or lower lip, right now that corner they like blister them. 3, 4, 5, then come together. Very painful. When herpes, so man we hear herpes, you can feel saying bad sick. Well, the virus way similar to the same M-pox virus. Syphilis, I don't talk about. Then of course, if you get infection of the skin and then come together like impetigo, fever, because they all get like the same thing. But the difference is that Chickenpox in yon na blister them where you get with white na plain water you see them. Whereas with the Mpox, that water did not they turn pus, they turn tough. So now one way for distinction, and then you only deep, then definitely deep. As I say, you can see the syphilis, it gets specific area the way they affect. Then get the thing we call macules, when a flat one, a rash, but a flat. Then get papules where erase, it bump. And then they get vesicles where erase, it bump, but you get water where they see through. And then like chickenpox. Then of course you get the one where the pustules where the skin don't break, and then the bugs then go through side the skin break, then it cause infection where they turn into pus or tough. Then this now 9-day boss, where they then get the crust, and then they begin heal from bottom up. Then after he healed on, he can then left the scar. So this again just to tell you now the differences between them Sikia. They're very, very unique, but if you look at them, you can see, say, as I say, they're very similar. Mpox, smallpox, and chickenpox, very, very similar. But you can see the thing, the way they cause them, they're all different. The smallpox now variola, and of course, you get this varicella. Then, of course, you get the strain them. Now, inside the chickenpox, you get 5 different gene them and 22 different strains, whereas with the smallpox, you get 4 types. And then, of course, we know Mpox, we don't talk about clade 1 and clade 2. Then, also identify they hide, the reservoir them. We know, say, for Mpox now, them monkey, them bushmeat and things and all that. Squirrel, arata. But now, smallpox, we know, say, this one, a mortal man, then definitely. Again, with chickenpox, a mortal man, then, because remember, I say, them picking them. Then I mean, them picking them small, then they come, then say, and get chickenpox party. So if one person, one picking get chickenpox, then go call all the picking at the street for let they all can join, so that when they get the sick chickenpox, then that at the end of it. You know, but we all know say no today because if you do chickenpox, can come back in the form of shingles. Again, how this thing they pass, how they come out from one to the other. We know say Mpox, well, face-to-face contact. If the person sneeze and cough, if the person the discharge or the fluid where they come out from the rash can touch the body and then it can cause problems. And of course, we know say animal, then of course mama to Pekin. Whereas similar, but no more, we do not talk about mama to Pekin at this particular smallpox. Then of course, again, we know about this in chickenpox. Now, this is very important. Again, if you watch, they're very similar. So up to 3 weeks, they're all similar. But the distinguishing features now, when you go, as I say, you get then stick here, then rash, and of course the swelling of the lymph nodes when are important. And you can see, as we say, this one they say umbilicated because if you feel like neighbor, you get in within the middle for the Mpox. But when it turn the pustule, when I get the tough panam, is different now from the other one. And another thing we differentiate the rash pan chickenpox, they catch bad, ajaibal. Now that made them can put that calamine and all that and the rest of it, and then give antihistamine for help with that. Now the sick, as you can see, 2 to 4 weeks, 9 at this one, the Mpox, but then smallpox, 5 weeks, and then of course chickenpox, maximum 7 days, speaking for them well for go back to school. But most important for me, the people that can die and the sick. See Mpox, you can see now 1 to 10%, but with smallpox now up to 50%, so almost half of the people that we get. Now I make it been dangerous, and I make WHO been team up trying to try for eradicate them out of the world. Whereas with chickenpox now, very, very unusual for let somebody die of chickenpox. So again, for let we go forward, the vaccine then what we get. Now, because we don't get a specific one, we can use any other one, but smallpox, because they're the same family, they don't find I make with the user. It'll be happy in 2023, that smallpox one day now be used when have been something with them and supplied to the military them. So this is not the thing I've been to talk about. As you watch them, you will see. But it's important because most of the time that we medical school, then they only they look at white man, then they look at black man. So we decide to make we see how we turn a black man body because we people in black people. Not to say they ignore them, but if you watch them, you will see. So again, now the macule, this we'll talk about a flat, but you see in red, and then you get the papule. You see in bump. And then, of course, when then they bump now, they swell, it break the skin, then you get, no, sorry, not the blister, this is not the blister, with the water dip and the chicken pox. Then when then they break down, because waiting you get the bug don't go inside then you become pustule, and from the pustule now, you get the breakdown we go cause the crust, and from the crust now, it will begin heal. When you heal, then you go, by 4 weeks, it go left that scar. So manual, sometimes superficial, to manual very deep, where you go left them, like how you get chickenpox mark na the body. So that's how it travels, you know, up to 4 weeks it can take. 2 to 4 weeks now it can take for ladies actually begin for well. This again just tell you no more how the thinking there, how we clear, and then of course when you get the umbilicated aspect of it, we turn like navel, you get clear fluid panam, the vesicle landing, and then of course you get pustules. Then of course it breaks down, and then you get the crusting, and then the healing. When he heals, well, there you go. That's a good day. So how you go take care of then lesion? How would they talk about then skin lesion? Yeah, well, of course you go look at the body. Usa it is from the hospital, then they map, then call them body map. They map them and find out so that if other one then begin grow, then begin develop, you go now know say from here, and so this non commodity don't go yonder. And of course, importantly, remember, it go everywhere in the body. So man you go there, na the team we call you man, the other one we call the person woman, and of course it's dangerous. You know, so at that point in time, obviously you need for abstain from doing mama papa business. If I no go switch you for do that because the pain way go dey pain small. But there you go. So we think go help you for stop this thing. Obviously, now you hand hygiene as we don't talk about before. Avoid for touch the sick them, the rash them where you get the body. If you get visitor them, we then come obviously cover them so that you know go upon them, the breeze no go blow, and then you go upon the nose, then they inhale, and then things happen. No, remember for where you PPE, that thing will protect you because definitely as we win a clinician them, now that thing they help you for no bring and kind of we us and for no pass on to the other patient then. So you wear the glove, the mask, and of course the apron. We go help you. Then the one them, as I said, the lesion them, then crow, whatever rash we day. If you watch them, the one doing a superficial one them, then can heal, not a problem. The one doing a deep one them, obviously, you get for take care of them, you get for be more intense in doing what you get for do. How you go cover them, how you go put the dressing pan them, and all that thing that you go do. But the one day we complicated, like the one we did, na the throat, na the mouth, you have to be really careful because then people in this sometimes the thing goes swell or they know if for drink or something, and that can cause more problems. So you have to be very, very, very meticulous in terms you go for watch and make sure say then development, then complication they cause the person for deteriorate. So man now you go for put inside this thing we then call permanganate, and like a solution when have been sort of purple one, like mauve, where they put down for herb. So man, they put salt water and all that, and all that they have for the crocro or the rash well. So at this point, I don't talk enough, but I go allow for me colleague, able bodied and eloquent, and all right, Dr. Sheriff, want to ask something? We go save them for later. You don't raise your hand. I don't know what you want to say. But let me save them for later. Dear Dr. Sheriff, is that all right? So, Ms. Sumare, Ms. Nafisa to Sumare, I go hand you over now. Is that okay?
I'll save them for later.
All right, thank you. Yes, we hear you. So tell me when you want for layer forward them.
Okay. Okay, I will tell you. Okay. Una, good evening, everybody. Una, thank you. For the one that we don't know me, my name is Nafisa to Sumare. I knows my background. But I don't move from hands-on patients many years ago. I moved into public health. So I work now disease prevention and control.
Until now, if you are forward, say next.
Okay, I'm not get a function in Wi-Fi today, so I use my phone. So in case I get some problem like that. So looking at the public health management for M-pox. So first of all, the first thing we have for happen is M-pox is a notifiable disease. The doctors then or health professionals then we suspect or diagnose M-pox per patient, then supposed to inform the public health agency immediately. That's not the first thing we for happen. Once you don't come to the public health agency, what they go do, they go conduct a risk assessment around that patient day to identify close contact that we don't become exposed to Mpox from that person day. Then they go obviously offer vaccination to them if the exposure day within 4 days from the last contact. If they within 4 days, then can give the vaccine. Sometimes they can give the vaccine after 4 days, up to 14 days if people away, then get immunocompromised problem, their immunity not very good, or they're vulnerable, they can give them the vaccine beyond 4 days. But waiting then they recommend for Guinea before 4 days, because see the symptoms will begin from the 5 days now. So if you get the vaccine before 4 days, it will be more effective. Now, before you offer the vaccine, you have to do the risk assessment and identify contact the assassin. And then contact them, we need for categorizing into different categories. The higher the categories, the more the risk to the person where they're exposed. So I begin with the highest categories when a category 3. So when public health people talk to the patient, then they ask them, waiting at the level of contact where you get with the person where get Mpox. And then the person go talk. So anybody will get direct exposure to a broken skin or mucous membrane. That means to say you get contact to the person in rash the way they're in body, the fluid way they come under that rash, they don't come in contact with you, the person don't come in contact with and all them body fluid them. You know high risk contact because you don't expose to anything and without you not get no protection, you not get apron, gloves, etc. Or sometimes you sustain sharp injury from that person, this and you need to know they don't use from that person. It choke you either sometimes where they clean or somebody you know person they work in a lab, sometimes the person in blood sample don't splash na your eye or anything and they go na your skin. You know high risk contacts as long as you not be use no protection at all. You know use gloves, apron or mask. Then in a high risk contact. So na category 3 contact than they. So what is the public health advice for them? Now, passive monitoring. So something they call passive monitoring means you don't need for isolate yourself. Because this is not clade 2. And so I remember where Dr. Kamara been talk about different clade them. The clade 1, it give more serious sickness to people, them severe sickness. But clade 2 get a mild type way. Most times it's self-limiting, it's supposed to actually heal on your own. Although itself can cause problem for some people them. So because this is not clade 2, the person only for self-isolate, if for just passive monitoring, which means it keep an eye on himself every day for 21 days. For 21 days from the time we get last contact with the person, if for keep an eye on himself, if develop any symptom, he's supposed to self-isolate that time, they not get contact with anybody and access healthcare. And the person again for avoid for they do sexual contact, for do mommy and daddy business, and for avoid for get close skin contact with anybody for up to 21 days. Then if I avoid for going near people the way they get immunity problem, people the way get immunocompromised conditions, people who get cancer, they get HIV, or they get liver problems, or some people who don't do transplant operation, then people they consider as immunocompromised people, then you catch infection quick. So you in a high risk category 3 contact, for trial, get contact with them and then they are told, till you 21 days period complete. Or people the way get woman the way get belly, or picking the way they under the age of 5, say they're very vulnerable, their immunity not very strong, so them picking and they, for going near there at all. And you for also avoid for travel for going to other country because you don't expose until you will develop symptoms within the 21 days, so you're not for travel at all. Next slide, please. So the other category in a category 2, when at the medium category, this now people will get contact with the person, now skin contact only, contact skin, which intact skin, which means you not get contact with the crocodile. But sometimes you get contact with the person, you touch other part of his body, we no get rash, or sometimes something and they where the person don't use in property, then items them, you touch them one and they where you not get contact with in crocodile or in rash at all. Or something and then you go inside the person room, you touch in door handle, you touch in plate and cup, but you don't actually touch the rash. So that you're in a category 2 person, but you don't touch things the way contaminated with the person, because it's inside the same room, so the rash not cover all anything and they, touch the rash directly, but you don't touch things the way in the use. Or you're a person where sit down, you're a passenger, we don't sit down near M-pox case on a flight or inside bus, you sit down directly next to the person. But the person to say well close, obviously, not to say rash they exposed, because if you rash they exposed, then they will put you under another different category when at the highest one. But this not possible, well close in rash cover, but you sit down next to them, you're in a category 2 person on a plane. Or you not get no direct contact with the person, but you've been there at least 1 meter away from them for 15 minutes. they talk to this person, but well, no protection at all. You not touch them, but you don't 1 meter away from them. But for 15 minutes when I don't communicate. So then they're on a category 2 and a medium category. So again, the advice is similar. That person himself, they do passive monitoring. They keep an eye on himself for 21 days from the last contact. If he develop any symptoms, he's supposed to isolate himself and seek health care for letting assess her and see if now actually Mpox symptoms they don't develop. Instead for avoid for do any sexual contact, for do my men that business at all, for get skin to skin contact with anybody, and also the person for avoid them international travel as well. Instead not for travel. Picking them within a category 2 exposure group, we know they just routinely exclude any picking at all. You get for risk assess and see what kind of category the picking they. The category 3 picking them, yes, they want and you go exclude them from school, but the way the category 2, go just routinely exclude them unless they develop symptoms. Next slide, please. So for the underway category 1, when a very low category, and the risk is low, means say not the but low. It means these are people that will get contact with the case we get possible get Mpox na the environment, contaminated, sideway contaminated, but he wear PPE, he wear the appropriate thing the way for where he wear apron, gloves, etc. So breach no PPE law because on 10 days somebody if you breach the PPE, it means say wear the personal protective equipment and fine or wear and complete, then in a breach. But in this situation, breach than they at all. You wear full PPE, you get contact with the person, or healthcare workers them were involved in the management of the patients, they wear them PPE, then they maintain the distance between 3 meters away. They not go very close and they 3 meters away, then a low category people them. Or somebody will not get no direct contact with the object them where the person they use, instead they within 3 meters of the Mpox case, or passenger where sit on 3 road and behind the index case. So if you sit on the index case, for example, like this road, people are waiting up to 3 road behind or 3 road before them, then people then they're not considered as high risk contact. They're all under the low risk categories, and all of them are category 1. Then for them, and they not even need for do any passive monitoring action. They're not need for they can travel, go anything they want to do as normal. But obviously, if he develops symptoms, then he's for seek health care. So that's all I guess for today in terms of the public health management. So the main thing, three main umbrella role for public health people them for Mpox. 1, they're supposed to do a risk assessment, identify, contact them. Then they advise the appropriate monitoring for the contact. And then if any of them contact and they develop symptoms, then for actually facilitate or arrange assessment by medical personnel for them contact and then see if they don't develop symptoms. That's all for me. Over to you, Dr. Kamara. Thank you all for listening.
Thank you so much, man. That's very, very eloquent, really succinct. Right. So as it were, Miss Nafisa Tusumari just don't tell me exactly with the categories, but here you are, specific to Salone, we get challenges as it were, and everybody or every country get their own challenges, but this one specific to Salone, and of course, because now we not Salone people and we audience million Salone people, and clearly we need for focus on this. Now, as it were, the caseload per clinician obviously very high, and therefore it always poses a challenge when something like this happens, where you can class them as a major incident, where which they're actually able to provide for maybe 50 people, but then the 51st person come, and then you need to provide for them, and then definitely that major incident, and that is what we find with the high caseload. And then the healthcare itself, because of one reason or the other, GDP or maybe finance or maybe cultural aspect, the healthcare itself very overwhelmed, that system. We not get for item, that's how it is. But how we would try for actually mend that or maybe improve that and get things moving in the right direction is one thing we will all go for discuss. Because of that, you get the potential for, for let the sick spread wider. Now, maybe that's the reason we make from 2023, it don't come back inside 2025. People are waiting at the provinces, at the, if you like, the villages and things like that. They don't get enough access to healthcare. So therefore, possibly, if there is stigma, again, attached to the or maybe cultural views, then probably then they go definitely cause problems when they go come. And if they're not come, then they will even cause more problems. Again, because of the transport system, community transfer go pose a bit of a challenge where go make people not turn to the particular place where them for go to in terms of seeking help, the right, the appropriate healthcare setting. Of course, every time we talk about alone, there's one thing or the other. If you know to rains, we get mudslides, you get sometimes an outbreak or something, or cholera or something, and then if you imagine 2014 we get Ebola, then the next thing you realize COVID came, the next thing you realize, well, this one came. So it's there, and as you try to recover, there's definitely a strain on the resources where we get. But of course, the important for the public health effort then and therefore focus on how we go strive for strengthen the surveillance system and how the contact tracing will take place, just like how my colleague and learned person talked just now, Ms. Sumari, say how we go for contact people and how we go for make sure say this one not get no yuki business, no underline, no, no what you call it now, corruption. Is truth as it is, and that's it, and so it is there. So how we go for expand the access to the healthcare services, and how we go for promote the public awareness and present that. Now, I remember Ebola being calm, they mean get that kind of thing, the way then they go from community to community, then get the megaphone with them, they announce people in the drive and things like just for get people them to not touch this, not do this, not do that, which maybe that's something we need for do. Well, the people in Yeri, the more than Yeri, the more they focus and the more it go better for them. And of course, we then get for a mass the vaccine them where we get available. Whether the government will actually embark upon such a notion, it could be important because the more we get the easier it is for them get their vaccine. And in so doing, imagine say all man need two. And so it's a lot. And so we get for implement the vaccination campaigns then. So this is not just how we try for prevent and for go further, but then you need for diagnose them. Like I say, una way or people away they sick, they don't probably get for need for know too much about this. If not be medical team I've been to talk to, I go talk about this as it were. But diagnosing this thing mainly for me, now getting this particular test done, but una no need for know about this thing. So I no go deep into them. But important for me is when you can to me, now A&E, now accidents and emergency, which I need for do. Now, of course, as they teach we always they begin A, B, C, D, E. Important for make I know the history. Who's you don't go, how long you don't come out from the place, how long you been there, the first symptoms where you develop and things like that. Who's kind of particular person you be, whether you're in a high risk or low risk or moderate risk. All them things they important. Then of course I go then begin for examine you. Sometimes I know you get enough time for make I get the full history. But if the person come with this problem, then the first thing that we go kill them. Therefore, important for make you always remember the airway. And the only for check for that is the person, the guy they talk to now, if you they talk to me, you know, say me airway patent. Therefore, I don't go get problem to that. But if you mean they talk to me and they say, I can't talk, I can't breathe, I get, then obviously, say now this person get problem. I need to address that before I go forward. And of course, the breathing, I go listen to the chest and all that, see how they breathe. If they get any added sounds like what they call then deep crepes, crackles. If somebody get infection in chest, you go see the oxygen level will go deep. It will go down. And obviously, if somebody they smoke, you go be less compared to somebody who they smoke. Then, of course, the circulation way, the blood pressure, the pulse, the person they sweaty, clammy, and all that. And of course, the person collapse or not, and the heart rate, all that they very important. Most importantly, though, if the blood pressure too low, it will cause problem with the kidney. Therefore, the person will go produce much urine. And then you go say now the person will go into shock. Then the kidney begin fail and then the other organ will go fail. It's absolutely important for when you don't begin see person where they get problem with B, now for begin fail in hospital road. D, now disability, obviously we go check for see how this person, like I've been talking about malaria with a cerebral, again, now that's what they check. But if this person, they talk to me and they make sense from which they talk, if you ask them for pointing in hand, now he knows, using right middle finger and the nose, he do harm, then he talk to you, and he say the person they sleep or whatever, we they talk to them, all then things, or the person gets seizures, begin get fit, or in blood sugar so deep because it's septic, now you get to actually get that. So important for that. Then of course, if you just left the person in cover, you not go see the rash panel. And if woman they bleed, sometimes you get belay, they actually lost the baby, you not go see them. So important for make you get all into A, B, C, D, E. Sometimes then if you not do E, you go miss the way them. the diagnosis, and that is why something then they fail. So the symptoms then signs them, as you can see, we get fever, pain, the infection. Now we don't go on top of the rash, we don't break down. And then, of course, inside the mouth and the bowel and the chest and the brain, all that thing, they can get complications. Then. If the person, they vomit continuously, then obviously you go get dehydrated, and then they go cause problems for instance, the kidney function go poor. Then, of course, if you get problem for breathe, obviously we go for treat that. And then, of course, then with the swell at the neck, it can cause problems for swallow and for breathe. Then they say that we go for look for. So if needs be, something they go for put them that the machine will go breathe for them. The eye, as we can see again, conjunctivitis can get problems, and then the other sick that we talk about, especially if I get HIV, mental health illness, sickle cell, heart problem, kidney problem, liver problem. All them people then definitely need for get isolation, and then obviously get to be treated accordingly. So again, this is just they tell you now how they treat them, as it were. Symptomatic relief mainly now that they give. Of course, if there's complication, we treat them. We go for hydrate them, we go for give them the necessary nutrition and the supplements the way they need. The skin rash, we go for manage them accordingly. And of course, if they affect the mental health, well, we go for do them as we suppose for do them. But the specialties or the specialists, them, then we definitely do that. But you need for remember, say, so Monday is sick one, not that bad, therefore, then go for send them home for let go self-isolate like how Miss Nafisa to be the sages now. So man now, obviously, if you don't, then can say what I don't pass Gary, then definitely they need for the hospital, and then we go for treat them complication them, and then of course, don't forget we go for give antivirals. In fact, some people then they, because of their lifestyle, then we give them what they call PrEP, we in a pre-exposure prophylaxis, and then get PEP, we in a post-exposure prophylaxis. So if you go into a relationship with a high-risk one, then go down, talk to you, don't inform you about the dangers and things like that, and then of course, then we'll begin trying to prevent that from happening. But of course, if unfortunately you get exposed, then the need for do as soon as possible for let the sick progress. So again, this one just to tell we how they prevent them. Avoid the contact directly with the patient that we get remember, I can't emphasize that enough. We will work with them. We need for get with PPE, the mask, the glove, and the apron. Then of course cover the rash inside the way exposed. The glove them we get for handle them appropriately, and then of course open the window for make it help for let you get the air in. We will actually help with the circulation and all that. Avoid for get sexual intercourse for do mama papa business. And of course, if you do anything at all, then obviously remember, say you go for practice safe sex. It's vitally important. We hand hygiene, I can't emphasize it enough. Then of course, inside the people away can the people in can tell you I do something. Inside they get for touch church. That the door handle them and all them places. Then you need for wipe them down as frequently as possible for help for just contain the sick. But this is the important bit, the stigma. Why on earth people in do this, I don't know. But remember, with stigma, we know they get anywhere. Because what you do, they discriminate against people them, like an identifiable group of people them or a place or a nation. That's not the definition. It's important for me to say if we do that, he likely say this person go hide in symptoms them or in sick, and he go keep away from coming for seek help immediately because waiting say then go talk about it or then go point finger at them. And then of course he could then prevent the individual or the people them for actually adopt healthy behaviors. Because then they say, bro, they don't wait none but me, give a dog a bad name like that, I will just do them. Well, important for me to say we know they harm anybody but we serve, because if this sick continue, also you go there where say this person get them, then you say go contract them. But if they actually talk about people them or begin point finger about people them, it probably will be a bit different. So what I go do, I get for educate myself on the facts and then shape them like how they do so now. I get for correct the negative language and the behaviors when they cause stigma, and then of course cause this accurate information is important for me to share them. How this virus is spread or any other illness for that matter is very, very important, because without that we can't go anywhere. And you can see now how this thing they affect from the Y and X axis, how this thing they happen, which it can cause the stigma. You can see psychological impact of the stigma. You get the policy-related stigma. You get misinformation, which is very important. All the people, then we will be depending on the COVID. then people will be scattered negative information about the vaccines and all that. And of course, awareness, as I talk about them, they use megaphone by Ebola for people. They need to be aware. They need for no and I make it fine for get them bulletin them. And of course, people in the affected areas. So a summary of all things we don't see already. Say the symptom, then from the headache to the fever to the swelling, as I say, of the lymph nodes that growing. It's very important to distinguish this sick from the other one. Then, and of course, they likely say you could get under the mouth or the gut or the thing we call you man or call you woman. And then, of course, how you go transmit them. We don't say not to just from the meat no more. You can scratch the animal can scratch you. Of course, it can be person to person because the mutation don't happen now. Especially we they at risk, we they treat them people, and the family members, Then of course when it happens, well, everybody knows that they get for self-isolate, and that is important up to 3 weeks. So you need to maintain that. And if obviously you come in, then go treat you. If they say you need for the hospital, then go treat you at the hospital. If they need you for go home, then go keep an eye on you, but then go contact trace, which is very important for know who's the person we don't get exposed to. Then of course, we treat them. We treat the infections in the skin, and of course, we forget moisturization for let this skin we don't well begin smoothing. And then, of course, remember, dental are painful. We need enough painkillers. Of course, we need for irate the room them, the place them within there, so that at least the air we go there and go begin circulate better. But most important is knowledge and avoid the stigmatization. Thank you so much. This is my reference system, just in case anybody interested. Over to now. Thank you.
Thank you so much, Uncle Doc. We family on a plenty thank you. Like I say, and for those who join late, we still say plenty thank you for who will be join we, but also for the support I don't give you over the years for 5 years. As soon as see, we come back with a topic within Uncle Doc say we come back with a bang. Hopefully, we don't learn a lot from within Dr. Kamara don't say. Now the floor open to her. I know see Dr. What's his name? Dr. Kamara.
Sheriff, yeah. Fuad Sheriff.
Yeah, I will ask her on mute. I think no, I'm not thinking it again.
All right, okay.
I'm not thinking it again. So now the opportunity, on a very opportunity now for to ask any questions.
Yeah, still they see Dr. Fuad.
Oh, yeah?
Yeah, that's right. Yeah.
I will check no more, na mic testing I will do. It's how it is.
He don't raise me hand up.
Yeah.
Let's see. There we go. I will do my test. I will check no more, maybe. I'm listening. Any listen.
No, I didn't listen. I will be waiting for make you unmute me. Thank you, Mr. Fuller.
Welcome.
First of all, I want to tell the organizers of Well Body Better Pass Gentry organizer, and thank you for this useful information. And obviously, Dr. Kamara, thank you so much for the eloquent and comprehensive review of M-pox. For way M-pox don't start a couple years back, I don't do a lot of CMEs on them, so I don't learn a lot of stuff from M-pox before this, and I don't learn more things from yourself again from this joining this you talk today. So thank you for your comprehensive talk, and obviously thank you to Madam Nafi for the public health pathway on the pattern we. I just hope say this year if we don't get more of we provided in Sierra Leone, we CHO them, the populace in Sierra Leone going for land some of the thing there, because you're talking in a plain way, not so scientific way you approach them. I wish we get about 2,000 people in now, because M-pox is really a big issue. I get some famicida in Afriton, and the reason I know more about the amount of people that they get M-pox, because most of the people that they get M-pox in salon, they never go to hospital. Now famicida they go. So we get, and most of the people that get with rash and fever, just then 2 things a day. But because of the nature of the endemic of the public health emergency over day, I make always tell and say, based on this rash when I send give me, based on this picture when I send give me, the same kind of rash way Dr. Kamara don't go over. this is a likely that this is Mpox. And most of them, when they can go now, they do the testing and all that stuff. They can send the family can send message back to me, say yes, Mpox. But most of the people there, they're not going to hospital. Now, pharmacy, they can go get pain medicine. Like Dr. Kamara said, their body can act. They can get fever, the body can act, and then they go to hospital. Most of them, now pharmacy, they can go. So pharmacy will not get our insight today for directing it properly. They just go sell paracetamol, Tylenol. They're not going to refer them for say medical hospital. Obviously they go able to do some of the thing away Madam Nafi talk about for self-isolated life after this, because the people they need that information there. So again, thank you so much for what you don't say. The only two I go add obviously the clade 1 and clade 2. Clade 2 or 2B, they call it the West Africa strain. And that strain they now this in alone. And the first thing that they ever come out in 2017, we in Monday where they sleep to other Monday. And that same person who pull on Nigeria in 2017. Now UK they go in 2017. And that thing can start. Then Sierra Leone, the West African strain will get on a 2B, obviously, and the mortality rate for that is 1 to 3%. Just like way Dr. Kamara talk. Then you get the Central Africa strain with now the Congo Basin, based on the map way Dr. Kamara just showed, and gets a higher mortality rate up to 10%. And they make most of the people then way you see they die in Central Africa and Congo, now they die, we get a lower strain, when 1 to 3%. So very little death rate is in us, very small. So thank you, Dr. Kamara. Thank you, Dr. Nafi, and the organizers. Now that's number one for sure. And Mr. Sedolan Boku as well.
Thank you so much, Dr. Sharif. Like what Dr. Sharif say no more. Yes, the mortality rate might be a bit lower compared to other places, but like what Dr. Kamara say, if we not look after ourselves well, we go put a lot more strain on already stretched health infrastructure will get that on. Because the more people that we sick, it means there's a lot more challenge, there's a higher challenge for the people that they able to deal with everybody. If they're able to deal with everybody, so until we're not for kill you, due to able to seek the right medical attention, we're not getting infrastructure for deal with that kind of volume there, it will lead to few people for them lost their life. So dear, the imperative of we all, a very important for we all for listening to the top player. Like what they say before, then people as soon as see Dr. Sharif, we know they get paid. They just come up and give this kind of talk. When I for take this very, very serious. If you go hospital for go get the kind, for go get checkup and whatever, like they cost you money. Now yeah, not free. On a let we learn, on a way we listen. Yes, Auntie Nafi.
Thank you so much, TJ. I mean, just want to add to what Dr. Sharif talk in terms of the public access in healthcare via pharmacies. I don't know if anybody there on this call will know waiting at the arrangement between the health professionals or healthcare workers in the community and the public health agency in a salon, because I know say there is a public health agency. I don't know which information they're going to pass to the community healthcare providers them in terms of waiting them for do and waiting them for the tell the patient. Because I agree with what Dr. Sharif say, 90% of people them, unless they're seriously ill, they're not going to hospital.
Dr. Sharif, you be able to ask, because waiting Auntie Nafi ask, I don't know if you will get an idea on given that you get access.
I feel say the approach where the government, obviously they get a public health system and the government is very centralized. And the question we ask, obviously, would be nice for see that approach they more decentralized, because the first point of contact at the pharmacy and at the community, and most of the people in the pharmacy and community, they now get this information for spread and give the people for educate the people them. Like we so for the last 6 months, we don't go back to we Ebola framework. We get buckets front we pharmacy them. We can they get for Wasian. Before you can inside the pharmacy, we get hand sanitizer, you give hand sanitizer, because the person away you give that money to, if you get that virus, they pay that money itself, the person instructor will get that. Now contact with this and so we get hand sanitizer, we get water bottle, we get water basin before you can inside the pharmacy. For the last 6 months, we don't do that, because me understand and know to the going, I don't do a lot of research on this there, but I feel say I'm sure. Not to be biased. I mean, the only pharmacy who do that, because I mean, I been talking about 4 weeks ago. I don't see any other place to do that. I don't see any public offices that they do that, like where they do that for COVID. So you still need hand washing. You still need hand sanitizer. People that get them. I mean, we don't see M-pox by about 4-year-old baby as well, where they bring get all the rash then. Where they send and go to corners, they test and the baby gets with because they can't, they don't buy calamine lotion and medicine for fever. Now say this rash look different. This look like M-pox. This baby is about 4 years old. I mean 4 months. Sorry, 4 months. So I wish the approach more decentralized, Madam Nafi, the way you question, way to ask, but the case in this case is very centralized so far.
Thank you so much. Hopefully, people in there we maybe get influence or maybe get access to people in high places. And then here, we were there in the Western world. There's something they call lessons learned. Not to say you could get everything right the first time. So it's good for we all look at the kind here and learn from each other. So if this is a way for we improve the current effort with the government they put in place. When they tell government waiting for do and how for do, and when they say no more, this is an advice. So it would be best as well for themselves look into that. Normally, like I said before, you look at what somebody else don't do, what work well for them, and try for replicate that and for make sure we help people. Dr. Kamara, I don't know, or anybody in the panel, somebody don't ask a question. Brahma Bangura, I say, what is the recommended first line of treatment approach for a confirmed case of Mpox? So what you would do, like where somebody, they don't confirm and say this person get Mpox. Waiting at the treatment where, the recommended treatment for that person. Then give few options. I don't know any of the options in the valid, but they say antibiotic, supportive care and isolation. You get antiveneal therapy with what? Oseltamivir. Wait, another doctor. I go sort that out. And again, another one when I
corticosteroids
therapy, something like that. Anyway.
Yeah, corticosteroids.
Right. You see, I don't able big well and I make a go cyber security. I didn't lost better year. So what's in your advice, sir?
Well, I mean, if you say treatment, I mean, it's a specific question. Wait, treatment. Now, when you don't get a confirmed diagnosis, now you go say with them, you say, I give you specific treatment. But because this thing, they come, like how Dr. Sheriff, they say, you don't say an 4-year-old baby. You look at the rash, the way the rash day, and how long it don't burst combined with the other symptoms, them, you will get a high, which we call high index of suspicion. We would say 90s. And so therefore, when they come with the temperature, they come with pain, these are the first things that we will begin for do. But obviously, it's important for making say the beginning of the treatment now when you actually establish which this person get, who side this person get this thing from. So if, for example, they tell you I just come out from Hong Kong, I come, and while I've been there Hong Kong, I've been go do some kind of business there with some time, I don't want me work for no or something like that. Then after about 5 days where I don't come, that this don't happen. All right, I begin get temperature, I begin get pain, I begin get swelling, I me growing, I me armpit. Then now say, this rash don't begin come out. Begin suspecting that it. So now, as Ms. Nafi they say just now, we need for then contact, now notifiable illness. If not that we suspect, we can get in touch with the number they would in the key. We call that number. But we in Ayana, Manchester, every day, we get what we call the specialist center, tertiary center, where then you talk to. Then get a registrar where they on call 24/7, where you go talk to about this person. Say you get high index of suspicion about this case. Now you go ask you question them obviously and the rest of it. You now go then answer as best you can, and now you go give you guidance now as to waiting for do. You see what I mean? But clearly, if the person can be definitely terribly unwell, you get for treatment, as I mean, say A, B, C, D, E. All that thing then the way they talk about corticosteroid therapy, well, not to the immediate thing that, but if the person in blood pressure is so low that you don't give them fluids and you need to respond to the fluids, then probably you might need to give them some metramine way for actually support the kidney in function. Antiviral therapy, well, that particular one day, I don't know, but I just know say if you say this now, M-pox, then clearly you need for use the one way and then they use winner the smallpox vaccine. You see what I mean? And then get the other one they within the give as treatment where maybe themselves equally effective, but maybe not as effective as the vaccine. Antibiotics, well, of course, if you get what we call superimposed infection, And the lesion or the rash where you don't get it, don't break. Now the person don't get an infection of the skin. So until you get cellulitis, as they call them, where the skin red, the painful, the swollen, the discharge and all that, possibly say you could give the antibiotics. But you need to give antibiotics to a virus or viral illness until you know say there's an imposed infection where because the immune status done less or done a bit compromised, now I make it then get this infection. Therefore, you need to be bound for treat the infection as well. So there's no immediate first line whatever. It's just that you need to know exactly what you deal with and then treat them as you find necessary. Now I make a supportive one. Of course, the isolation again depends how bad the person is. If you really sick to the point where the throat, the ambogu, or the belly don't bust the perforation, then clearly they can bring you in. There's no questions about that. If you get epiglottitis as they put up, or you get encephalitis as they put up, clearly you can't go home. Then get for keep you in. So again, it depends on that. I don't know if that is helpful at all.
Yeah, I think it's helpful. Thank you very much, Dr. Kamara, and also thank you very much, Dr. Mr. Brahma Bangor. I'll get another question also from Lama. It say if we get if there's any, well, not a we, but if there is there any evidence, you know, or indication, say the transmission as alone come through the LGBTQ community.
Me not this alone. I can't tell you within the percentage of the population weighing LGBTQ plus. I don't know, but I know say definitely when the sick begin, as Dr. Sharif the talker, 2017. I went them in finance in a man to man, MSM, that's what they call them, the phrase down the man they sleep with in company man, them being get them. Even most of the cases them that the UK now imported one. Now whether now that it don't restrict itself, so I don't believe, because now you can see over 4,500 people who don't contact this thing now, the vast majority of them. And in fact, the woman way I did this thing to you about, we die, obviously not a woman way na gay person. Definitely. Now be good Muslim, but then again, people can live their lives differently. But as I say, the problem we get here is we don't know the percentage of the population we get then sick that day. Whether we need for then think about how we go get a screening, because I know one person where they do hepatitis B screening that's alone, and they encourage people to come forward free of charge and then get the test done. If they're positive, anonymize them, and then they begin get the treatment anonymously. That's one way for actually get things, because of avoidance of stigma. But I can't tell you that because of LGBTQ, the percentage is now 10%, and so therefore the propaganda or whatever it is will for mount for be up to 10, 15%. I can't tell you that. We need more details for that for be able to actually say when well, this, that the thing. Because most of the time people can go hide that talk, they say me not gay or me not too gay, again, because of the stigma. So that narrative we need for try and teach and preach against.
Okay, thank you very much, Dr. Kamara. I believe that I don't answer Lama question. You know, it comes down to really anyhow it transmits or starts or whatever like that. The problem is we get her now we country, and they don't, you know, the one day we don't learn boku understanding here. Don't tell we the various ways them how we will catch them. So the best thing for law we do, don't try for avoid law, not do anything, and they letting this thing end up catch we. Because of time, we can round up. Okay. I go start with Dr. Sharif for let give people them a final word. Then I will go around the team for letting give you the last word for today. Do you have a fan them? If you been get question we able to ask today, not feel say because today don't pass, you know, can ask you question. I've been share the WhatsApp number. I will try for put the link as well to the WhatsApp group now. Yeah? Feel free for reach out to the WhatsApp number and ask you a question. I will pass the question on to the team and somebody will reach out to you with an answer. Dr. Sharif, do you agree with Fambo my last word for today, please?
Okay, thank you, Mr. Fuller. I mean, all I can say, I'm glad you were in the beginning. I really say you record this there. Dr. Kamara's presentation is phenomenal. So anybody we know be there at the beginning for watch this there, wanna watch them, they can go back and watch them because you don't even need to forget any medical background for go back and see this thing. It's very comprehensive. It puts it in a very simple way. It's a big problem currently in Sierra Leone, and obviously, when anything that don't come within the population, probably every couple of years they get for the same. I mean, obviously they don't eradicate this year na Congo or Central Africa. It don't do this since the 70s. Every couple of years, this year they pop up. So don't be surprised. Every couple of years, this they pop up inside Sierra Leone.
Thank you very
Thank
much,
you
sir.
so much, sir.
Thank you so much for your contribution. Thank you so much.
Yeah,
Anthony,
TM, sorry. Oh, you want to ask a question?
no, I just
No, I just want to give a shout out to the other colleagues. Then we find time. Dr. Coker, Patrick Coker, Dr. Kumar. I think one of the very prominent people. I see your name Kumar. Yes. And there's a few other members, and then the people that we did at the Muslim Jama, na Freetong Day, na Bombay Street. A big shout out to them and any of the audience. We don't 5 years, so definitely we happy for come back online and do which we know best. So I thank you very much, and we hope so we will spread the word and then we will forget yourself, further Usaudi than Usaudi now. Thank you so much for that.
Thank you very much.
Thank you guys. Thank you.
Auntie, you get any last word for you?
Yeah, thank you. I just want to tell everybody thank you, and I want to let the health professionals they waiting at the community when they go more likely for see the patient and they let them not forget for tell the patient for self-isolate, because I know so go see the contact them, but the patient where they come in contact with you where advise on say in as much as you treat them and get them all the medicine the way for them. Tell and say make it not get contact to people that are vulnerable, pregnant women, they immunocompromised, young children, they're under the age of 5. Like isolate because the infectious period, the infectious from the time where the rash begin up to the time where the rash they heal, as Dr. Kamara said. So the person is supposed to isolate. Then just for the and then remember say, well, body better pass gently. Thank you.
Mr. Fuller, I gave for impact one thing.
Yes, sir.
For them, one we will get for travel tongue in this year, either December, whatever. Be careful. I know of at least 2 people then we don't know personally. We'll go visit Salon. We'll come back in the US. We'll get M-pox. So when you go tongue, hugging and touching, all that kind of thing a day, you can palm fist somebody, you can get an elbow. Be careful with the close contact with people them. You get for be careful until this day I go away. Because we know of 2 confirmed case. We don't confirm in the US now. We'll come back with M-pox.
Thank you so much. Now, very good advice, Stanley. Thank you. Because like I've been this December, January. So yes, it makes sense. Thank you so much. Dr. Rashid, lawmaker and shots, please. Yeah, we'll round up. We don't slightly past time.
Yeah. Fambuda, thank you for attending this important talk today. I'm glad it's small because at least government don't they be a little bit proactive. So do you when then can't happen for they listen to what the Papa government they say, but also I want for appeal to the pharmacists them. Dr. Sheriff say most of the people then are pharmacy then they go. So pharmacists when they sell una medicine, do you wanna advise the patient there? Make they also go see doctor na hospital, because it's possible say the drug where you they sell not do for men the patient. But if you direct them at the right path, then go able to get the help where they need. Una thank you. Then we all members say, well, body better pass gentry. Una thank you.
Thank you very much, Dr. Rashid. Dr. Ture?
Thank you for today. Una can join me, Dr. Kamara. Thank you so much for a very good presentation. You don't say everything. That's not much for add. I go on say in addition to waiting and Dr. Sheriff say, my wife also get a patient will come out saloon. When a Caucasian, we get Mpox, he can to her, he get for referral to public health and everything. They do everything and they need for do. They try for push for the vaccine even, but I think in stage by the time they don't do all the assessments we then get for say now, be actually need the vaccine. Some of the lesions they don't dry basically. So now we know say a real just like I'll say way person they travel go salon, then cases that they can happen. And also I'm for throw light to I think the question somebody be asked, Dr. Kamara don't clearly answer them, but just for let you know say that antiviral we put that Tamiflu we put there. Now enough for mainly influenza. and then they give for they know they get influenza, common cold na yeah, not so for M-pox. Tecomavir, now the one way I think Dr. Kamara put on a slide, yeah, Tecovirimat, you know, now one night we get, you know, severe cases to within the gi and the pseudofovir, now then and the gi for the severe case them. So then they mainly now Tamiflu within the gi to elderly people and now we exposed to flu and all that if needed. So we'll tell you thank you people for join. And I hope say this go down well. And then they see them pharmacists or nurses, they let the nurses them back, not just pharmacists. I think say nurses them more now than they do more of the medical role, now than the doctor, they most times, most places there. So let them be able, let them genuinely tell the people if they know certain rash, you know, come out say, you know, this why I don't understand how much, maybe isolate or get other people and contact the public health or tell people for isolate or give them the right information, because mainly na information people they not get. That's why they do this program. Let them go get the right information. So tell them thank you or not join me. Thank you.
Thank you very, very much. Now, the other thing I want to say as well about the nurses in our community, because I know a few nurses and I know, you know, as soon as somebody sick class along the first way and they say, well, you know, I get me nurse. You say go hospital, say no, I get me nurse. But and you don't talk now. Dr. Angela Nancy Samu.
Good afternoon. Thank you very much, Dr. Kamara, for that wonderful presentation. And Hajanafi, thank you so much for your public health contribution. And Dr. Fal, thank you for your contribution. If I'm I don't read the word, I don't need to go over anything again. When I just see basic hand washing, it really prevents so many things, and Mpox now one. And Dr. Fuad mentioned, say, I think not to be even during COVID, Ebola self or so. Well, maybe not COVID, them get a lot of things them outside now them major government offices them for wash hands. So maybe we need for reach out to the public health unit that's alone, let them begin implement that as well. But family, thank you for the word and share the word with people. Them this recording will available on YouTube. And I will spread the word and may we reach out to the locals, especially I think in a free tongue you get more of nurses and pharmacies where people and they go, but maybe in the provinces I don't know if that the community, the CHO them, and then people then most of them can pose as a doctor. But let we try for refer people there. If you see something we're not able to know for 3 times, we're not already understanding, not to crime, not to for say you don't know what you they do. I make you get your colleagues them for help. My family on a thank you, and on a never forget to everybody, it better pass gently. Go back.
Thank you very much. I like the style, I like the clothes. We'll talk about that later. HRH.
Good evening, everybody. Una thank you. Una take time for join. This really important topic today. Mr. K. Ajanafi, Una thank you for brilliant presentation. I don't get much for art, to be honest, other than I put a question in the chat just for like how Dr. Angela just mentioned for public health alone, if thank you able for please issue flyers to, you know, like a community announcement, maybe that could help for let people the way they not the pharmacy them just refer people them straight to hospital. That could help. Una thank you again. God bless.
Thank you very much. Dr. Bell?
Yeah, if I'm doing a good evening, Dr. Kamara, Nafi, and Dr. Sherry, thank you for the presentation and contribution. When I don't say everything, I don't say much. Which in HRHF say I find very important. Say forget flyers for bring the information out. The tool to do so now one thing, and we'll put on YouTube as Angela said, don't say. But I find out say public health agency, and they do a very good job and get this Facebook page where then they update everything, updates the cases then. So if they're able to put out the case, then they are most likely I hope saying they put it on TV as well, or they announce it on radio as well. The amount of cases where they get daily, and for make people then know down there as well. And also, yeah, flyers. If they get some flyers, where they go and spread out to the different pharmacies them as well. That could be also great. And I believe say they don't think about that before, and maybe they look for sponsor, or maybe they do already. But then and me a gynecologist, so I big do on a protect with better woman then, because better woman then can really get severe sickness if they get this Mpox. And if they get the Mpox, into one Mpox and get Mpox, the probability for make the pickings get a high, the probability to make the, as Dr. Kamara have done talk, the woman and lost in pregnancy is very high. So I big do on a protect the pregnant women then, yeah. On almost say well body better pass gently.
Thank you very much, Dr. Bell. Now, very good point you bring come up so. And also when it comes to the Facebook page, you know, it good say they get the Facebook page, but it would be good as well if they try for make people then be aware. See that page they did, and also then good able to go. Then get bloggers and local bloggers and that song. For them bloggers and they, if anybody there also as well, we get access to them people and they. My advice is not to just for pass the normal local gossip, but it's also about then get that social responsibility as well for passing kind of information. You are free of charge, no need for be paid, just like how they do also. You know, all land for look after the community. Okay. Aisata Fuller.
Yes, sorry, I'm driving. I've been listening. The presentation, very good. Thanks so much.
And your network really bad.
Possibility for the self and you hear me?
Yeah, your network is really bad.
Okay, they hear me now?
Try
they hear me now?
Yeah, if you turn the video off, sometimes you will get better power.
Yeah, it's on the video.
Alright, my family, because of time, I'll get for mute Aisata. But on our plenty, thank you for we would have done join with today.
Anyway, responsibility. We don't know.
Okay. Right, Dr. Kamara, you agree with the last word, and then we'll wrap up for today, please.
Oh, as I say, I'm really grateful. Family members, and they don't come out, then can't join me. We're really grateful. As I say, we come back as we come with a bang, which is good, and that's we aim. We don't set the bar up, so we need for progress. But remember, please, let the word spread, because we need that for people that know what they do. As I say, people in the pay for this kind of thing we do, so but we need to get 1 penny. So if we will get sponsors, it go nice, because we don't do 5 years and we no more they do this thing on we own. Important for let we know say the breath of life by any organization and money. It's as simple as that. So if we get any generous donor, somebody they feel, very generous for deeper in our pocket, when we get to a website, we get to bank details as well, we account details where anybody, nothing, not too little. Every little helps us and say, so dear, with the big, and if we get people who go for actually help you for this thing, like how Dr. Sharif they suggest, important. We happy, we ready for prepare for present. The problem is how for do them, and we need the air time so that the word go reach to the people and I make like Krio they talk. So dear, spread the word, invite any person we go for camp and join we and at least try and get things moving forward in the right direction. But remember, even the doctor self need doctor. Therefore, well body, better pass gentry. Thank you.
Very much. I don't need to say anything more because Dr. Kamara not been well this week. So the doctor need doctor. Family, we will meet again in 4 weeks. Well body, better pass gentry. Good night.
That's brilliant.
Thank you.
Stop the recording.
Right, okay.
So Dr. Kamara, wait, so which beach should they